In most cases, when a provider orders a genetic test, blood collection is the gold standard in genetic testing. It's common practice and it has been for a long time. However, many families aren't getting their child tested because blood draw just isn't an option for them. We've heard from many providers that they've stopped ordering certain tests because families refuse to put their child through a blood draw. That can be particularly important for children with developmental disabilities who have certain hypersensitivities. With Lineagen's FirstStepDx Plus CMA service, we have elected to validate a buccal cheek swab DNA collection and use that rather than blood collection for our CMA. We've chosen to use the buccal swab for 3 main reasons. The first is the ease of collection. No one enjoys having their blood drawn, and a cheek swab is much more familiar territory for a child. Parents will often help with the collection of the DNA. They often tell their child, let's pretend we're brushing your teeth. That's something the child isn't threatened by. It's something mom or dad can easily help with in the office. It's much easier to use. And it can be done right there in the evaluation room. The family doesn't have to go halfway across the medical campus or down the road to a phlebotomy station. In addition to ease of collection, the DNA collected from a cheek swab can be stable for much longer than a blood draw. If I were in a clinic ordering a blood draw for a patient, I would have to worry about how that's shipped. Is it shipped overnight? Do I have to put this on ice or dry ice? What's the temperature outside? Are we in the middle of winter or the heat of summer? With a DNA cheek swab used by Lineagen, the stability of that sample lasts up to 2 months, 60 days. Room temperature is the best way to ship and store the sample and provides us that flexibility. We're able to do the necessary work with the insurance. We're able to contact the family. We don't have to get that done within a couple days of getting the swab from the physician's office. The third reason why the cheek swab is preferred over the blood draw for our CMA service is because the results are actually technically better from the cheek swab. Let me give you an example. We've had a few results now where we have identified mosaicism for a certain genetic finding. So mosaicism, think about a mosaic pattern of tiles, 2 different types of tiles. We have found 2 cases of mosaic trisomy 21, the medical chromosomal abnormality for Down syndrome. And in one of these children, we actually collected both his blood and his buccal DNA. When comparing the results, there were 20% of his cells with the abnormality in the cheek swab compared to just 5% of cells with the abnormality in the blood sample. If we had only tested his blood, that diagnosis would have been missed. And of course, having a diagnosis of trisomy 21 is very critical for a provider to know so that child can be put on a special healthcare supervision plan to look out for the risks associated with Down syndrome.